How would you describe the feeling of knowing that there's a basic resource that is available to others but is beyond your reach to care for yourself, your children, or your loved ones? When health care is beyond our reach, we feel powerless and afraid in the face of immediate and potential consequences. Just think of your baby's tears, your throbbing pain, and the fear of the unknown, or what could happen. In a community with limited or no access to healthcare disparities exacerbate the social disparities and vice versa, becoming a cycle which deepens the unmet needs. Affinia Healthcare has provided preventative and primary medical, dental, and behavioral health care to those most impacted by socioeconomic barriers to wellness in St. Louis since 1906. Affinia Healthcare offers the expertise to effectively address the unmet healthcare needs in our community. However, the breadth of the unmet needs throughout the broader community exceed our capacity and resources. In 2018, the Affinia Healthcare Foundation was created to address unmet healthcare needs in our community by supporting strategic initiatives of Affinia Healthcare. Right now in St. Louis, there are zip codes where 18% of African American babies are born underweight and premature, which have long-term impacts in lives of our children.
My name is Kiara Standifer, and I work at Affinia Healthcare on LIMP for the Women's Health Team. Yes, I am a patient. I have a baby due September 13th. At Affinia, you don't feel like just another patient. You are treated with kindness, with respect, and you are treated as if you're family. And I think being pregnant and all the stresses of pregnancy, especially high risk, you need that. You need that care and that compassion. People should support Affinia Healthcare because we contribute to the community, and we also don't leave you blind. We make sure that you know what you need, the things you need to do it, and you also need that care and that compassion. We give that because there are a lot of people that truly need help, and they need to know where to come to get that help, and we provide that for them.
Right now in St. Louis, there are zip codes where people with chronic disease become disabled or die much too young. Right now in St. Louis, women die of cervical cancers that are 70% preventable by the HPV vaccine. Right now in St. Louis, children suffer from dental pain and loss of permanent teeth, as dental cavities is the #1 chronic disease in children in our region. Right now in St. Louis, loved ones are dying from opioid use at 4 times the rate than in the past decade, and opioid deaths in St. Louis account for 70% of all opioid deaths in Missouri. Addressing these dire needs are among the top strategic priorities of Affinia Healthcare. We believe that healthcare is a basic human right and that no one should be left behind or suffer due to lack of access to healthcare.
I'm Tom Kuchecha-Kernan. I'm a family physician that's been working here at Affinia for 30 years. I do holistic medicine. I work in our chronic pain team. I work in our substance abuse treatment program. And as I see it, at the heart of our work here at Affinia is this: every person is precious. Every person is equally worthy of the opportunity to get their important needs met. As we create access to primary health care to people denied it elsewhere, we honor their dignity. And when they come to us, we treat our people with the best medicine, first-class care, careful diagnosis, treatment optimized for their needs and preferences, and understanding of how to care for themselves. So they feel better and their bodies function better. So they suffer less and can do more of what they need to do and want to do. We need your support. Please join us in realizing our mission.
We believe that healthier people, children, adults, families are the best foundation for strong communities and happier lives.
In 2018, Affinia Healthcare conducted a community needs assessment with input from our patients, clinicians, and community partners. We then implemented a set of clinical initiatives in order to immediately address the most critical needs identified. We also developed a set of strategic goals for transformational impact in our community. The outcomes of these actions are proving that we are moving in the right direction. 93% of Affinia Healthcare's babies who are born to moms in our Centering Pregnancy program are born right on time. This means fewer premature babies than the national average, healthier babies and healthier futures. Our chronic disease initiatives are making a marked difference, earning national recognition for our clinical quality improvements and leading to healthier lives. Our opioid medication-assisted treatment program is reaching twice the number of patients as the year before, saving lives. With the right support and resources, our patients are learning and thriving. The needs are great. Thus, the solutions must be bold. We are ready to act boldly as we are inspired by the patients we serve. With the support of our donors, community partners, and staff, we can make large and strident steps toward achieving this vision. A healthier St. Louis for everyone. To support our mission, please go to affiniahealthcare.org/donate. We are grateful for your support. Thank you.